Dr. Nicolaas Pronk. It's a great honor and a pleasure to have you closing this ceremony of the 11th IESS Award. Dr. Nico Pronk is president of HealthPartners Institute and chief science officer at HealthPartners, and holds a faculty appointment as adjunct professor of social and behavioral sciences at the Harvard T.H. Chan School of Public Health in Boston, Massachusetts. He also serves as co-chair of the U.S. Secretary of Health and Human Services Advisory Committee on National Health Promotion and Disease Prevention Objectives for 2030. Not only that, he is also a member of the Community Preventive Services Task Force. What an important and socially relevant task, Dr. Nico. Our mission, one of the missions of our institute, is the improvement of health plans in health insurance sector. As we all know, health expenditures have been increasing continuously, making it more and more difficult for buyers to pay the monthly cost of health plans and health insurance. One important action to prevent such rapid growth of plan monthly prices is to invest in health promotion. And this is all within our reach. It is shown by the splendid book by former Chief Executive of the NHS, Sir Edmund Nigel Crisp. The title of his book is Health is Made at Home. Hospitals are for repair. We believe that health is made at home. And this is why the Institute, yes, chose population health promotion and people's engagement as the driving idea of this 11th annual award. We know that in your professional life, Dr. Pronk, you have supported and in fact worked according to this idea. So we are looking forward to hearing from you what you have to tell us in the next half an hour. Thank you for accepting our invitation. Dr. Nico, we want to hear you.
Thank you very much, Jose, for the invitation. I really am honored to be with you today. And I have some comments that I can make on this topic. I truly agree with the title of the book, that health is made at home. And anytime we're sick and we need care, it is for repair. Very much so. Well, my title is not Health is Made at Home, but my title is Health and Wellbeing. Who is in charge? It's who is in charge. I truly believe that people themselves need to play an important role in their own health and well-being. And you need to take charge whenever it's necessary. You need to be a partner with your physician rather than just a patient receiving care and not being involved in any of the decisions. So with that in mind, what I would like to do is talk about health and well-being and making sure that we all agree what is meant by that. To talk a little bit about what determines health and well-being. Where does it come from? Where are the roots? Where is the foundation? And then there is a shared responsibility, particularly related to health literacy and being able to understand what is being asked and what's needed in the context of health. Then we also need to make sure that we can measure what's going on. And so can health and well-being be measured? And we'll follow the definition on that front. Then I also would like to introduce a case example. And we'll talk about a program. Actually, it's an invention that we have created over the past 15 years that really allows for a partnership between patients and physicians. And we'll finish up with conclusions and maybe a short discussion after that. From a definition perspective, the work that I was involved with Healthy People 2030 in the United States, we were really able to bring well-being into much more of a pronounced context related to health. But when you bring well-being alongside health, you need to recognize that those two terms are not the same. Health is different than well-being, and well-being is different than health, but they're very closely aligned. They relate to each other very closely. So our team came up with a definition that really describes the term health and well-being as a single term. Not a definition of health, not a definition of well-being, but one of health and well-being. And it's how people think, feel, and function at a personal and a social level, and how they evaluate their lives as a whole. So this definition comes from Healthy People 2030, and it recognizes that health and well-being happen at the individual level, but also at the level of this society, if you will, meaning the nation as a whole, the states, the municipalities, the communities, as well as within organizations, including those of employers. So it is nested, if you will. Individuals aggregate into groups, into states, communities, and into a country as a whole. And that's a powerful context. So knowing then that we have this kind of a definition, it does start to transform the opportunity that exists to improve health and well-being by looking at it in a context that is much larger than the individual itself. It also recognizes that the environment in which we live is important. So the term health and well-being implies separate but related states that influence each other in a mutually reinforcing relationship. So they work together. Together, equitable health and well-being describes factors that are deeply rooted in personal and societal values. So we think of social justice, of safety, making sure that you protect the health you have and promote the health you want. But also in doing so, we work on prosperity, particularly at the community level, as people work together across the community. We think of issues like civic engagement. You know, as people, for example, vote, they participate in democracy, and doing that has an impact on your health and well-being. And then there is environmental integrity as well. Without a healthy environment, it's very difficult to stay healthy and well. The framework then that we place this in is that the center of this Mobius loop is health and well-being across the lifespan. And we recognize that in order to do that, to achieve that, those outcomes of health and well-being, we need to cultivate a healthy environment. And that means a physical environment where we live, for example, as housing issues, the parks and streets around us, but also our social environment. For example, the way that we work together with others when we go to work, or the economic environment, the way that we participate in the economy. At the same time, we need to close gaps. We want to eliminate health disparities. We want to address health equity issues, and we want to address health literacy. In addition to that, physical, mental, and health dimensions, social dimensions, are also addressed, and access to quality care is important, particularly clinical care systems that provide opportunity to repair when repair is needed for our health. And then increasing knowledge has to do with shared responsibility across sectors. We need to work together between health and healthcare, the business and industry sector, the transportation sector, all different sectors working together, because at the end of the day, they all have an impact on the health status of individuals and the community. We need to generate public health successes, particularly when we think of today in a COVID-19 world, how important it is to stay healthy and well and safe. That can all be done through evidence-based programs that include laws, policies, and practices. And finally, we need to set measures along with objectives and generate data to make sure that we can evaluate how well we do at this effort. So this broader framework has been very powerful to generate opportunities for interventions, to measure and monitor progress that is made at different levels of society, and to ensure that we have goals, shared goals, that we can pursue as a society. So then the question becomes, what really determines health and well-being in the first place? Well, lots of different ways to look at that. But one way to sort of say what health and well-being, what generates health and well-being, is this idea that that it comes from a variety of factors. Healthcare is really, at the end of the day, about 15% or so of the total variation in health of a population. Most of the variation is explained by other factors, including health behaviors, the degree to which people participate in healthy living lifestyles and healthy living behaviors, the social circumstance of people, whether or not they are in a positive environment, their physical environmental exposure, if you are exposed to fumes or gases as part of your job, that creates hazards and risks. And then, of course, there is a genetic predisposition that everyone has. All of that would explain health in total. But only a small proportion then of population health and well-being outcomes are really driven by the clinical care delivery system. It's only about 15 to 20%. So the Pareto rule of 80% versus 20% really does apply here. Most of what generates health and well-being involves structural, cultural factors that shape social, physical, and economic environments, and thereby influence how we behave. So thinking of this as an iceberg, it's only the tip of the iceberg when you think about the healthcare system and how that affects health and well-being. Most of what determines it is all that exists underneath the waterline. So then you can ask, what then can an individual do? Much of what happens is related to the environment. And in fact, when we think about chronic diseases, also known as non-communicable diseases, they result from a combination of genetic, physiological, environmental, and behavioral factors. That's really where they come from. So there are no genetic factors that can be studied independently of the environment. And there are no environmental factors that function independently of the genome. So it's all connected, it's all related to each other. So the way I'd like to think about it is, it's not the cards you're dealt in life, it's how you play the hand. So that means you can do something about this. You can take charge. You can protect the health you currently have. So for example, wise use of clinical preventive screenings and services. In case of disease or disability, you want to make sure that you manage those diseases optimally. And a lot of that has to do with your decisions about when to access the healthcare system, how to access it, and what to make sure you receive when you do access it. You can also sustain the health you have into the future. Optimally, you can do that by healthy lifestyle behaviors. If there's anything that you can do for yourself, don't smoke, get enough sleep, be physically active, don't misuse alcohol. Those are all the things that your grandmother always told you. Pretty simple stuff, but it's difficult to do in certain environments. But that is the best way to sustain the health that you have and not lose it. From a clinical prevention perspective, be up to date on preventive services. We know that getting screened for certain diseases is at particular age times of your life is very important. And you want to make sure that if you have a disease, that you diagnose that early so that management is much more effective. And periodically, we think it's also very important that you step back, that you take a look, you take stock. How are you doing in life? Clearly, this idea of periodically a life evaluation that is important to you as an individual. So you can just ask yourself, how am I doing? And do that periodically, maybe once a year at the time of your annual review at work. How are you doing? Very important. So in other words, be in charge of your own health. Ensure personal health literacy. Make sure you know what to ask for. And when you do get something from a clinical care perspective, that you understand what that means. Be a wise consumer of medical care resources. Anytime you get too many things, it's not a good thing. So you want the right care at the right time for the right person. And see your doctor as a partner in your care. Have a conversation and a discussion about decisions that need to be made for you to be optimally healthy. We just talked much about the environment, so we have to also ask, what can health systems do? Certainly, health systems are responsible to make sure that there is easy access to high quality, affordable care options. To make sure that patients and members receive evidence-based information on best care options for members and patients. And that the system is proactive and focuses on prevention of disease rather than treatment only. At the same time, implement care protocols based on science and evidence of effectiveness, and be sure to provide resources that enable health literacy, making sure people have the tools available to them to understand their options. So to speak a little bit more specifically about health literacy, and I think of this as shared ability, also part of Healthy People 2030, we tackled health literacy straight head on. And we basically decided that the definition of health literacy really does have two components. There is personal health literacy, which is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. But in order to have access to those type of resources, you also need organizational health literacy, which means the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So it's a duality. There's a dual role here. It's of the individual patient or member of a health system, but also the health system itself, and making sure that there is an opportunity for people to participate in this issue to the fullest. So basically, it takes two. It's the ability of individuals to find and understand and use health information, and the ability of healthcare staff and systems to communicate clearly, to provide patient and participant resources for understanding, and design services and products to be easy to use. And that together creates health literacy. Now, there's also health numeracy. Numbers matter. As some would say, some is not a number, and soon is not a time. So numbers are important. Numeracy is the ability to access, interpret, and use quantitative information to manage one's health. That means, for example, how do you read a food label? How do you adjust medications? How do you monitor health metrics? How do you pay for healthcare bills when they do show up? And so there's all these labels and graphs and information that people need to navigate through in order to make the right decision. And really, to be able to make that right decision, you do need to understand what these graphics and this information all means. And it's a widespread issue. Anyone can have limited health literacy skills, anybody. But in particular, it happens a lot among higher risk groups such as over age 65, the elderly, less education, ethnic and racial groups, limited English proficiency in English-speaking countries. Of course, in Brazil, it would be Portuguese. and poor or near poverty levels. And so those are some examples of particular groups that need more support. And health systems should make sure that there is a focus on serving those kinds of populations. So then we get to the issue of measurement. Can we actually monitor progress as we work in these issues and ensure population health from that perspective? So we've done a lot of work in this area. And as an organization, HealthPartners, my home organization, we have created a summary measure of health and well-being. The summary measure contains 3 components. It's where we're at, current health. It's where we're going, future health. And it's how we feel about it, well-being. The way that those measures are put together is that current health really is represented by years of life lost due to morbidity and mortality. And this is data that comes out of our electronic medical record. The future health is really about sustainability of health as measured by the presence of health behaviors. So for example, we measure on a regular basis. So we actually survey 5,000 people every year about their healthy eating behavior, physical activity, whether or not they use tobacco, alcohol misuse, adequate sleep, healthy thinking, which is really about gratitude, and their use of preventive services. And those measures go into our metric. And then finally, how we feel about it, well-being, is really a self-report of life satisfaction. You know, when you think back about that idea of stepping back periodically and taking some inventory of how you're doing in life, this is the question that we use, life satisfaction. And so the measure of health and well-being is directly linked to the Healthy People 2030 definition of health and well-being, which is how people think, feel, and function at a personal and social level, and how they evaluate their lives as a whole. So this grid talks about the key terms in that definition: think, feel, function, personal level, social level, and life evaluation. And then we look and see if the current health, the future health, and the well-being metrics that we have actually represent those key components of the definition. And the current health metric, for example, when you think about thinking, well, we have electronic medical record data that has to do with diagnosis codes or use of processes that deal with neurologic observations, psychosocial observations, feeling, emotional health and mental health, functioning, physical health or musculoskeletal issues. It's measured at the individual level, but also rolled up to the group. And we ask people for a life evaluation on their well-being, so it doesn't apply under the EMR metric. In terms of future health, as I indicated, we have a survey that goes out every year that people the level of gratitude for the things they have in their life, which is about healthy thinking. And then preventive services use physical activity, smoking, sleep, fruits and vegetable intake, and alcohol, which is really all about thinking, feeling, and functioning. It's done at the individual level and the social level. And then finally, our life satisfaction question completes the grid because we ask literally specifically about how they evaluate their life as a whole. So this grid indicates that our summary measure of health and well-being literally covers the entire definition of health and well-being. And then we report out, first of all, to our board of directors, which is made up of our members. We are a not-for-profit co-op, so the members own the company. And we report to our own members how we do on an annual basis. We then set goals for every 5 years that hopefully improve the health and well-being of the people that we serve. So for example, here is a report version of 2019. Current health was 65.7% of what health could be. Our goal is to get to 71%. So we're not done yet. We have a lot of work to do. Future health is 65.3% of what it could be. Our goal is set at 79% for 2025. And well-being, we are at 80.4%, and our goal is set at 85%. And on the right-hand side of this graph, you can see what the performance is of our system over time. And unfortunately, you can kind of also see the impact of COVID. It's very difficult at this point to have major improvements in health and well-being when so many people are affected by the pandemic. So a lot of work to do across the board. But let me give you an example of some of the tools that we have created in our own system to address these issues. This is a clinical decision support tool that is completely embedded and integrated into our electronic medical record. And it is a support tool for providers, our physicians, as well as the patients. We call this system the Wizard. It's a clinical decision support tool. It's integrated with the medical record. It prioritizes clinical actions to support optimal patient care. And what that means is when the physician stands literally in front of the patient at the time of the visit, the information goes into this system, and about 0.1 second later, it tells the physician what are the most important things to do with this patient in order to improve their care. Because as you know, any patient, there are many, many things going on. And how you decide what to focus in on may well be the most important outcome of that visit. So it also helps activate how patients take care of their own health. And there are algorithms running in the background that are derived from available evidence-based guidelines. So we look at all the guidelines that are applicable, and we implement those through a decision support tool. This system is currently used throughout our organization, serving about 1.5 million members and patients, as well as at federally healthcare qualified safety net clinics across the United States. It's been shown over the last 15 years now in randomized controlled trials to improve patient outcome. It's also shown to be cost effective, and it was developed by our own institute. How does it work? Well, it identifies patients with the greatest potential to benefit from attention to clinical care needs. So it identifies basically gaps in care. What should the patient really focus in on, and how can the physician help in doing so? It prioritizes the individual's clinical need based on potential benefit, and that benefit is tied to longevity outcomes. And it displays treatment goals, treatment options, and treatment suggestions that are personalized to the individual patient. So it has everything to do with the individual that is there, not with the average of the group. It deals with issues of medication, with behavioral and lifestyle issues, with safety considerations, with referrals to perhaps other specialties, as well as tests that may be needed or that are due. It provides printed information for a patient and a clinician to support patient engagement. So the patient has an opportunity to take this home and understand it better. And it provides tools within the electronic medical record. So there is a linkage of available tools and resources that a physician can use. For example, if there is a need for a laboratory test, we can quickly make that order or refer to another part of the clinic or a specialty clinic, or to address and adjust medications as examples. To give you an idea of what it looks like, this is a patient view. So if the patient looks on the screen and looks at their handout, you can easily see how certain things are more important than other things. So this is a patient printed view, and it's designed to address literacy. So for example, you can quickly see that there are 3 of these stop signs, if you will, that basically say this is very important, more important than 2 stop signs or 1. So tobacco, stopping tobacco is the most important thing that this particular patient should do. They should get screened for opioid use. Their cholesterol is too high. and their blood pressure is too high. But their weight is not as bad as these 4 factors above it. And their blood sugar is doing great. So this is very quick feedback for an individual patient to sort of say, if you can do anything right now, if you were to pick one thing that you should focus on, stop smoking. But if you can't do that, let's make sure you get screened for opioid use. So this helps making decisions. The physician has a different view and has more information that is clinical information. So for example, there's a lot more information on blood pressure, the laboratory information that is related to it, the type of medication that the patient is on, their body mass index, their aspirin use, CKD, the chronic kidney disease information, and laboratory information on the bottom. So there's a different level of information that is more clinically oriented. And for a patient, this would be probably too much information. This, however, is very useful for the provider. It can be given to patients when needed or when wanted, certainly those with higher literacy and numeracy. So it can be shared. But there are also some additional benefits that we've noted are happening when physicians use this tool. So for example, we've noticed that it promotes health equity. The clinical decision support algorithms are unbiased, which is helpful if you want to minimize human bias related to gender, for example, or limited health literacy, or race or ethnicity. And so this is a powerful tool to address health equity issues. And just a reality, when there are many things to do in a clinic, this tool really helps prioritize which option is the most useful one to focus in on. And that option is connected to the most potential benefit. Repeated use of this system captures what the patient thinks they are ready to act on. So for example, if stop smoking in our example was the most important action that a patient could take, is that patient ready to do so? And if they're not, maybe there's something else they are ready at that time. And using this system also builds trust. And there's a real need for trust when you think about the relationship between the clinician and their patient. An opportunity to make sure that the trust is not only built, but also maintained over time. Of course, the patient perspective is incredibly important here. The experience going through this system in patient care allowed us also to ask questions about how patients experience this system. And so there we note that 97% of patients experience the wizard as a positive clinical encounter. So pretty much by and large, this is really helpful when you think about the engagement and the relationship that the physician has with their patients. It also indicates that 63%, roughly 2/3 of patients report that the interaction with this system helped them act or at least found them to be helpful in recommending what kind of action to take, whether it was deciding to make a move or to discuss the health issues with their providers. And here are some examples of testimonials. So we feel very good about what this system is doing to support the patient care with the in the context of the physician's interaction. And like I said earlier, if we think, for example, about health literacy, there is a component that is related to individual actions, but the organization has a role too. So I would like to conclude by just indicating that for optimal health and well-being, patients or people really in general need to take charge of their own health. You need to be in charge, and you need to think of your physician and your care team as partners in your own care. You need to find understand and use the information and services to inform your health-related decisions and actions, which is really personal health literacy. More medical care use is not always best. You should avoid too much, but you also should avoid too little. So there's a happy medium there. And in order to figure out what is right, what is not too much and not too little, you need that health literacy. You need to engage in your own care and understand your needs more than anybody else. So you need to protect the health that you have through healthy behaviors as you go into the future and optimal use of preventive services when they're needed. Partnering with your doctor to optimize the care you need, absolutely critical. And you need to do that in the context of a healthcare system that makes sure that there are systems to ensure equitable health and well-being and health literacy, that you have access to those kinds of systems, and that there is support for individual patients and members to take charge of their own health. And support can come, of course, in many, many different ways. So it should be an ongoing dialogue. This should not be a project that gets done by Tuesday and is done by next Wednesday. It's an ongoing dialogue and a conversation over time. So with that, I'd like to just stop there, and hopefully this has given you some ideas and suggestions and observations that can be useful in improving health and well-being for the people that the health systems in Brazil serves, and hopefully has an impact on how people experience the care they receive as well. Thank you.
Thank you, Dr. Nico. Your presentation was excellent, lively, and very rich. And in fact, so much aligned with the title of the book I mentioned at the beginning, Health is Made at Home. You are responsible, are in charge of your own health. I think it's always important to remind us and everybody of this very fact of life. I wonder if you can take a few questions, Dr. Nico.
Yes, of course.
I'll do the first one, then Alberto Gatro the second. Dr. Nico, we are witnessing a very rapid growth in the prevalence of overweight and obesity, and its consequences in terms of growing prevalence of chronic illnesses, different kinds of chronic illnesses. I guess that much of this should be due to important changes in our environment, in our lifestyles, in the way we feed ourselves, in the way we think, as you mentioned in your presentation. Part of these changes lie outside of our governance as an individual, but an important part depends only on us. What your experience with population health can tell us about this? Are our lifestyles modifiable? What can motivate people to adhere and stick to the new healthy lifestyles, Dr. Nico?
Thank you. So you're asking a very, very difficult question. I personally think that obesity is one of the major drivers of ill health outcomes. And yet, over the past 30, 40, perhaps 50 years, we have not been able to do much about it. In fact, when we look at the data, obesity prevalence has only increased across the world. So I think we need a paradigm shift. I think it's clear that individual solutions are not the answer. We need to change the underlying systems that have an impact on body weight. And so this is a difficult issue because basically today, a lot of systems interact in a way that generates more and more overweight and obesity, rather than supporting an environment in which individuals can easily address issues of overweight or obesity. And so I think there is a real need for work that happens in parallel with what individuals do themselves. So certainly there are, of course, many reasons why you would want to be physically active and eat as healthy as you can, besides body weight. I mean, there are all sorts of benefits related to physical activity, for example, that have to do with mental health or social health or emotional health. But if it was just about body weight, it's very difficult for an individual to overcome an environment, whether that's the physical environment, the social environment, or even the policy environment, in which policies that are not supportive of healthy food, for example, generate a reality for many people in which they just cannot access healthy foods in the first place. So there needs to be, I think, a parallel effort that is not short-term, but long-term, that can take a look at how these systems work together, whether that is transportation, economics, farm bills, regulatory environments, that all have to do with how food is coming at the end of the day to the individuals and their families, all the way from farm to the table, and really take a comprehensive look at that and see what can be done to make sure that those systems are in fact set up to provide our society what our society wants. Because right now they're not giving what our society wants or needs. So we should take a look at them and change them. But that's a difficult thing to do. So that doesn't mean it can't be done. It's just difficult to do. And so that's why I'm calling for a parallel effort rather than a focus on a smaller effort, a program, for example, or an intervention that can be tried, because we've tried that for 30 or 40 years and that didn't work.
Thank you, Dr. Nico. These chronic illnesses are multifactorial. There are different causes behind them. And so any solution must be composed of very different types of measures. Now, Alberto Ganta, would you like to make your question now?
Oh, thank you. First of all, Professor Nico Pronk, it's always a pleasure and honor to learn with you. For years, I am learning with your lectures, papers, but mainly with your values, your personal values, and empathy is very, very important for my life. Thank you for joining us again. I have just one question. What would be the first step for the employer to act in conjunction with the health plan so that workers can have better health and well-being? I think we have many stakeholders, the vendors, the health plan, but the employer frequently act in another silo, also with the human resource or occupational health, and you work with the total worker health model, and we learn very much with it. But what about the first step for us to have the employer on board in this effort? Thank you again to join us, Nico.
Yeah, thank you, Alberto, for this question. It's a very important question because it's one that allows an employer to prioritize, which is always difficult. In particular, it's difficult because when you ask about improving health and well-being, the health and well-being needs of every individual is different from another individual. And so there needs to be, I think, so in my view, the step that an employer should take is to partner with their health plan, is to partner in a way that allows clear communications. We talked about systems earlier. I think communications is another system. And if those communications can be made easy, clear, concise, actionable, that would be just fantastic. In addition, the employer, I think, also should look at flexibility. What that means is it possible for a worker to make decisions about their health and well-being needs when they need to be made, regardless of whether they are on the job, off the job, in the context of their family needs? So give the workers a little bit of flexibility to make those decisions and be engaged in their care and be confident to make those decisions when they are needed. Have flexibility. That doesn't mean that the work doesn't get done, but there is flexibility for a worker to make alternate arrangements, to find, an hour off, or to be able to take their kid to the doctor, or whatever it may be, so that they can work together within the team, within the work team, to find a solution. When there is such flexibility, then workers feel really good about taking that responsibility themselves. If there is no flexibility, you basically end up delaying the care that people need, and that's not a good thing. So I would say the first step for an employer: partner with your health plan, communicate well, and give people flexibility to take action.
Oh, thank you so much.
May I make another question, Dr. Nico?
Yes.
I am not trained in medicine, so forgive me if I say something that doesn't make sense. But I hear among professionals, practitioners, that they tend to play down changes in lifestyles as a way to prevent certain diseases or even to reduce their effects in our organism. I assume that they would see medical evidence regarding to these aspects. Are there available in the scientific literature evidence of good results of following healthy lifestyles, healthy eating, and so on? Is this lack of evidence or not being aware of it an important inhibitor of moving towards these healthy lifestyles, Dr. Nico?
Yeah. So it's very well established in terms of scientific evidence that a healthy lifestyle is incredibly important for overall health and well-being. There are many, many studies that show, for example, physical activity or sleep or healthy nutrition is absolutely very clearly related to a higher level of health. The problem is that oftentimes it's very difficult to translate evidence-based interventions that work in a small study, to translate them into practice where the practice is scalable and sustainable. And that's where the gaps are, the evidence gaps. So this brings us back to our conversation on obesity. It's the same here. It is possible to change behavior, but in order to do so, you need an environment that is supportive. And again, that environment is a physical environment, it's a social environment, and it's an economic environment. And so when you think of it as systems, the structure of systems is important important. It sets the boundaries, if you will. But the incentives that those systems provide are also important. And so in order for people to change behavior, there needs to be a reason. And oftentimes those reasons are not so clear. So I think there is definitely a scientific evidence gap when it comes to translation, but there is no doubt whatsoever that the importance of healthy lifestyles is clear when it comes to outcomes of disease and disability.
Thank you. Ogata, would you like to make another question?
No, not exactly a question, because I think Nico offered a very comprehensive presentation. And just a commentary about the health literacy, addressing not just health issues, but the patient understanding the complexity of health system, and how to use it in a wise way, and the boundaries. And I think it's a very interesting thing, Nico, because we understand that most patients do not understand our complex health system, and
yes.
It's a challenge.
Yes, and you asked me about what's the first step an employer should take. I think the first step a health plan should take is to provide easy access to member services. A health plan should have easy access for their members to ask questions.
Oh, yes. Today, in this event, we are releasing a manual for patients, teaching how our private health system works in different channels. And I think it is connected with your speech about health literacy. Thank you for bringing this idea for us, and we'll try to work this way. Thank you so much.
Wonderful. Thank you so much for having me today. Really appreciate it.
Thank you ever so much, Dr. Nico, for accepting our invitation, for your excellent presentation. I hope it has an impact on our audience, on our society, on our health systems. Thank you so much.
You're welcome. Thank you.